Here, we share a useful tip for cataract surgery in a patient with vitreous hemorrhage. This video was already shared on cataractcoach.com, and of course, we all know that Professor Uday Devgan explains it much better than we do. But for those who haven't seen it yet, I think it's always worth sharing again. The main key point is that the lack of a read reflex can make it hard to see the cortex and capsular bag and other structures during the surgery. So watch this out, because I really think that this tip may help in your next cases. So by now the rhexis has already been completed with the help of tip and glue. Then the nucleus is removed as usual. Here I recommend taking care to avoid getting too close to the capsular bag and aspirating the fragments at the level of the iris plane. Notice how there are still cortical remnants that are barely visible. Sometimes it can be challenging to find the right plane that allows you to aspirate them easily. Now, check this out. Here's the tip. Through the infusion port that has already been placed, use one hand to insert the endo-illumination. This will help you see the posterior capsule much better, and with your other hand, you can aspirate the cortex. Of course, this is a patient who will be undergoing combined surgery with vitrectomy, but I truly believe this makes things much easier and is not difficult to do. Once the cortex is removed, you can implant the lens without any issues and proceed with the vitrectomy. Many surgeons have commented or suggest that you can do the vitrectomy first and then aspirate the cortex and place the lens, but honestly, I don't recommend doing that. In combined retina surgery, it's better to finish one step and leave the anterior chamber alone. The stability is crucial in these combined surgeries, so don't mess with it. Complete step 1, which is the phaco, and then move to step 2, which will be the vitrectomy. Believe me, having a stable anterior chamber and performing a good surgery where the balance between the two cavities is maintained is the best thing you can do. As a fellow or a retina specialist, this will really make things much easier when you move to the next step and start operating on the retina. You really have to perform the cataract surgery as smoothly and perfectly as possible. So now you have another tip to implement in your next surgery, and as always, thank you for watching.